Hello, everyone. I'm Dr. Shi Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University. And this week happens to be National Public Health Week, and I wanted to present the a new type of determinants of health, which was proposed by Dawes in 2020, which is political determinants of health. We all know what social determinants of health are. Um, we know about the upstream factors like equity and some of the other factors that are upstream factors that lead to disease. And so a lot of times inequities that affects marginalized populations is something that is important to grapple with. So first, I wanted to start off by reading this and then zoom into this picture to see what it says. So the political determinants of health create the social drivers, including poor environmental conditions, inadequate transportation, unsafe neighborhoods, and lack of healthy food options that affect all other dynamics of health. So by understanding these determinants, their origins and their impact on the equitable distribution of opportunities and resources, we can be better equipped to develop and implement actionable solutions to close the health gap. So this goes into a lot of different components as social determinants of health. But what is what is important to understand is that some of these factors are not in the forefront when we're talking about social determinants of health. So let me go into this diagram and take a look at what political determinants of health mean. Um, So here is a kind of a blow up picture of this. Let me go in a little bit more and take a look. The foundation, honestly, is advocacy. Do your diligence. Contact your advocate for to your representatives or your senators, showing your discontent, even going into some websites and signing a petition might do that. So advocacy is is the health outcome. So systematic, avoidable, unjust, and then negotiation, introspection, direct action. So these are some actions that can be taken. And so inequities or injustice to marginalized population leads to advocacy, doing your diligence. Um, and these are avoidable. So if you want to, you can go from there to discrimination, and discrimination could be structural, institutional, interpersonal, intrapersonal. So, like structural racism is a real thing, and implicit bias, all these different things can lead to discrimination. So after discrimination, you can, and this is where the political determinants of health are different. Um, Engagement, money, demographics, technology. These money and technology are more political determinants of health, especially allocation, proper allocation of money. So there's commercial interest, there's privatization of certain services. For instance, if you go to the glucose meters and strips, there's Freestyle, and there's other companies that are providing these services, and with the cost, with a considerable price. So if there's choices between food and getting glucose meters, then you would select food because that's what is creating that's what your more viable option. And then, of course, this is going into national security, economic outcome, and morale. Um, so that goes back to commercial interest and can go back to engagement money. And so it's kind of a two-way street. So a lot going on here. And then they can directly just link up each other between engagement money and national security economic outcome. So this is the main area that is important to understand in the political determinants of health. And then, so when you happen to vote, this is where you're really showing your advocacy and is different in the political determinants of health. And then that goes to government investment value. So this is where we're talking about allocation, and I made a separate video about government allocation to things like SNAP benefits, WIC benefits, and all that. Wanting to dial things back to Eisenhower's time or even further, and of course, voting policy. All of these, so um, all of these top facets are especially important to understand political determinants of health. This drives the uh, this drives the rest of the diagram, and kind of is connected to advocacy. Finally, then we can go on to the right hand and talk about political determinants of health, which are other determinants of health rather than our five um, domains in the social determinants of health. Um, so the political determinants of health, inequity, which inequitable access for impoverished individuals, marginalized population, and then if this is operating correctly, then there's equity, and equity means a the more equitable um, serving more of the marginalized population in a more equitable fashion. So this is a lot of things going on in this diagram. Honestly, there's probably um, multiple diagrams going on in one. So, and I would like for you to appreciate some of these arrows that are going into different places, and kind of study this in that perspective, how this is different. Kind of compare this to social determinants of health. Again, this was created by Daniel Dawes in 2020, and I think this model should get more traction than it does now. So that's about it. I hope this has made some sense. Thank you for listening.